This video is going to cover using electrical stimulation to promote muscular re-education. And then I'm primarily going to focus on using neuromuscular electrical stimulation and a Russian stimulation technique. One of the most common indications of using e-stim in order to promote neuromuscular re-education is in the case of a central activation deficit, such as a post-op ACL or TKA patient experiencing arthrogenic inhibition within the joint. Just a little background on electrical stimulation. We know whenever we use a motor stimulus, it's going to recruit muscle fiber motor units in the opposite order as a physiological contraction, and it's going to recruit the type 2 muscle fibers first. And this is important because after an ACL rehab or a TKA procedure, those type 2 muscle fibers are not being recruited very often due to the decreased willingness to move from swelling and pain, and then just overall loss in strength and neuromuscular input to the muscle. So some general precautions and contraindications for e-stim and using it for neuromuscular education is the precautions are cardiac disease, impaired sensation and mentation, malignancy, and then any skin irritation or open wounds. And then contraindications include cardiac pacemakers, implanted defibrillators, unstable arrhythmias, over the carotid sinus, over venous or arterial thromboses, and any woman that is pregnant if we can't use e-stim over the trunk area. And then application of the neuromuscular electrical stimulation or the Russian stim. We are going to use 2 electrodes, and we're going to place the electrodes along the length of the muscle that we are stimulating in a parallel fashion to the way that the muscle fibers are running. So if we're focusing on the quadriceps, we're essentially just going to place those e-stim pads along the fibers of the muscle. And if we are using the electrical stimulation in order to promote neuromuscular education, we're going to want to promote an isotonic contraction with that as well. So proper positioning of the patient will include a patient in a supine position with a bolster under the knee. This is going to provide a slight flexion within the knee. And then we can provide a strap over the ankle, and this is going to put the patient in a position to contract the quads during the electrical stimulation. I briefed over where the electrodes should be in a parallel fashion along the muscle fibers. And then next we just want to set the parameters, and this is going to be, for a Russian stim, this is going to be about a 25 hertz frequency of a biphasic current with 50 bursts per second, 10 millisecond burst duration, 10 millisecond interpulse interval, and then 10 seconds off and 10 seconds off, 10 seconds on and 10 seconds off for the on-off time. And then we want to instruct the patient that we want a motor level stimulus, so we do want to see a contraction. It should feel rough, but it should not feel uncomfortable. And then we also want to, so we're going to turn up the intensity in order to get that quadricep contraction. And we are also going to instruct the patient to perform an isotonic contraction in sequence with that electrical stimulation in order to improve that mind-muscle connection and get that quad firing volitionally and from a superimposed electrical stimulation.